Preface: Why Dizziness Matters. Many people don't know much about dizziness or vertigo. As soon as you or someone you love has dizziness or vertigo, then you instantly need to become an expert on the subject. Trust me, the situation can go from irrelevant to emergency in an instant. My goal in writing this book for you is to create a guide to help you navigate through the healthcare system. You will quickly realize that the healthcare system is not set up well for dizzy patients. My message of hope is that you can still get the care you need to feel better. My mission as a doctor of physical therapy is to rescue mismanaged and misunderstood people with dizziness, vertigo, imbalance, and chronic falls. This book is not an encyclopedic reference of all medical problems that cause dizziness or every possible treatment for dizziness or vertigo. It is also not a substitute for professional medical advice. This book does not contain instructions for exercises or maneuvers that people can use for dizziness, because every case is unique and the proper care must be determined on a case-by-case basis. I could not begin to offer you individual medical advice or instruct you in any exercises unless I evaluated you personally. Rather, this book is intended to help you identify the right healthcare providers and work more effectively within the healthcare system to get answers and relief. All my professional experience has been within the healthcare system in the United States of America, USA. However, the insights I share may be helpful globally. My first attempt to resolve dizziness as the focus of my professional work. I took my first training in vestibular rehabilitation in February 2006 at a physical therapy continuing education course. Before that course, I did not have the skills to directly resolve symptoms of dizziness or vertigo as the focus of my patient care. Shortly after that training, I received a new patient who was falling all the time because of chronic dizziness. She had been injured and was recently in and out of the hospital multiple times. Her primary care doctor referred her for home health physical therapy, and that is where I came in. This patient was 76 years old when I met her. She had experienced dizziness and vertigo for 20 years. Since the age of 56, she had been feeling dizzy and living alone. She had learned to walk around her house, dragging her fingers along the walls so that she could balance herself. She had seen multiple doctors and stayed in the hospital multiple times for evaluation of her dizziness and for treatment of severe fractures caused by falls. Despite all that medical care and attention, nobody had determined the root cause or why she was so dizzy. She had MRIs and CT scans of her brain to rule out a stroke or a tumor. She had cardiac testing to see if she had a heart problem. By the way, those tests are particularly important if it is suspected that somebody has a problem with their brain or their heart, because those are potentially life-threatening problems that need to be discovered. Like many dizzy patients, she suffered from a delay in proper care that lasted for years. She was also subjected to unnecessary diagnostic tests and took medications for many years that did not really help. I thought this was the perfect time for me to use my new vestibular knowledge. I opened up my vestibular physical therapy training manual and said to her, "I want to give this a go. Are you game for me to assess and try to figure out why you are dizzy?" She said, "Yes, let's do it. I have been dizzy for over 20 years and I am so sick of it." I assessed her for all the potential contributing factors of dizziness and vertigo I knew of at that time, which is a pretty long list because dizziness and vertigo can be caused by so many different body parts and organ systems of the body. Vestibular physical therapy, or VPT, which is also known as vestibular rehabilitation and vestibular rehab, is the type of care I now provide full-time as a master clinician and expert in this field. But in early 2006, when I met this patient, I was a beginner at providing vestibular physical therapy. With my training manual as a guide lying open on her bed, I completed her full inner ear vestibular assessment. Since her doctors had already ruled out all the possible cardiac and neurological issues, it made sense that her vestibular system may be the unrecognized cause of her dizziness. No one had even considered that possibility yet. I found that she had little crystals loose in her inner ear, which is the most common vestibular condition called BPPV. In most cases, BPPV, or benign paroxysmal positional vertigo, is a remarkably simple fix if the patient goes to the right healthcare provider who is specially trained to assess and treat the vestibular system. After only 2 or 3 visits with me, her BPPV was resolved. She was finally free of all dizziness and vertigo. No more fingers guiding her steps through her own house. She could confidently step out of her health-imposed prison. We then completed a series of follow-up visits for general physical therapy to improve her walking stability, muscle strength, and balance, since she had been debilitated and homebound for so long. She had to practice walking on her grass, lifting and carrying her garden hose and grocery bags, transitioning up and down curbs on her own, and walking on slopes and inclines. She bounced back to a great quality of life and even resumed driving. Before we met, she had been unable to drive for about 20 years due to the dizziness. She became my best marketing person and handed out my business cards to all her friends. We even got together a few times over the years to visit or share a meal. Eventually, she did grow old and pass away. Before that, she often reflected with amazement that she had suffered with dizziness for 20 years of her life and nobody could figure out the problem. Yet I was able to fix it for her in only 2 or 3 visits. One time as we shared a pizza at her favorite Italian restaurant, she looked me in the eyes very seriously and said, "You realize the vestibular physical therapy you offer has the power to change lives, right?" It was really unbelievable. For both of us, that experience was life-changing. I had literally seen her get her life back right before my eyes. That was when I realized the power of this knowledge and the way it could make an impact on someone's quality of life. I have not looked back. In fact, I have now focused on solving this problem and dedicated my career to the relentless pursuit of relief for people of all ages with dizziness, vertigo, balance problems, and falls. I have completed the most advanced training available in vestibular physical therapy and have even gone way beyond that specialized body of knowledge by reading literature from many different medical professions, shadowing numerous specialty healthcare providers, and seeking mentorship from a wide variety of professionals who treat dizzy patients. I am able to look at the big picture. When analyzing a case, I consider all the body systems and body parts that can contribute to dizziness and vertigo, along with the whole person, the environment, and their lifestyle choices. "You are a sleuth," said one of my patients. To an extent, that is true. I spend a lot of time investigating and determining all factors contributing to my patient's discomfort through a unique, comprehensive, and detailed methodology I have developed over many years of focused clinical practice. I have also now trademarked my innovative and integrative method of root cause analysis and resolution of dizziness and vertigo, called the Bell Method. I have become what my husband coined the Vertigo Detective. I wrote this book for those of you suffering with dizziness and vertigo. If you agree with me that you need and deserve more than just a bill and a bottle of pills, keep reading.